Welcome to the course on the use of fluoride varnish to prevent dental caries. Thank you for registering for the course. The course is intended to provide a basic understanding of various types of fluorides, their uses, and a simple application technique of a fluoride varnish to prevent dental caries. The course will be useful for oral and dental care providers including dentists, dental hygienists, dental assistants, dental nurses, and school dental therapists, primary care teams including nurses, midwives, and community health workers providing care to preschool children and any others who are interested. By the end of this course, you will be able to describe the basics of fluorides and their role in preventing dental caries, describe the products of professionally applied topical fluorides in preventing dental caries, and perform the application of fluoride varnish to prevent caries in young children. This course is divided into two modules. Module 1, Use of topical fluorides to prevent dental caries, and Module 2, Application of fluoride varnish by dental and other health providers to prevent dental caries. Welcome to Module 1 on the use of topical fluorides to prevent dental caries. By the end of this module, you will describe the basics of fluorides and their role in preventing dental caries, and list the different types of topical fluorides and explain factors to be considered in their use in dentistry. This module is delivered in 3 units. Welcome to Unit 1, Basics of Fluorides. This unit will provide an overview of what fluorides are and the different sources of fluorides. The word fluorine is derived from the Latin word fluor, meaning to flow. Fluorine is a trace element which belongs to the halogen family. Fluorine is highly reactive and rapidly transforms into fluoride. Fluorine is an element, while fluoride is the negative ion of the element fluorine. It occurs in the form of compounds that contain fluorine. Fluoride is commonly found in the environment. It is found in rocks and soil in the form of compounds like fluorspar, fluorapatite, and cryolite. From the leaching of soil and rocks, fluorides drain away and reach groundwater and other water resources. All water sources contain fluoride, but the concentrations of fluorides vary in these sources from minimally detectable to greater than 10 parts per million. There are several other natural sources of fluoride. Commonly available fruits like banana, avocado, strawberries are rich in fluorides. Groundwater, seafood, rock salt, and tea are the other common natural sources of fluoride. Congratulations! You have now completed Unit 1 of Module 1, Basics of Fluorides. In the next unit, we will look at the effect of fluorides on teeth. Welcome to Unit 2, Effects of Fluoride on Teeth. In the last unit, you learned about basics of fluorides. In this unit, you will learn how does dental caries occur and the role of fluoride in preventing dental caries. Let's briefly review the structure of teeth before understanding how fluorides work on teeth to prevent caries. The crown is the part of the tooth that is visible in the mouth. The part of the tooth that lies below the crown is known as the root. The tissue that surrounds the base of the teeth is the gums. As you all will be aware, the outermost protective layer of the tooth is called enamel. Enamel is the hardest substance present in the human body, composed mainly of calcium hydroxyapatite and partly of organic materials like proteins. Below the enamel is dentin, which surrounds the pulp. Inside the pulp are the blood vessels and nerves of the tooth. Some teeth have only one or two roots, but others, like molars, can have 3 or more roots. Dental caries, also known as tooth decay or dental cavities, is the most common non-communicable disease worldwide. Let's see how it occurs in the first place. The most important factor for dental caries is intake of free sugars. Free sugars are sugars added to a food or drink. Sugar present in honey, syrup, and sweetened beverages are also considered free sugars. Dental caries occurs when bacteria that are present in the mouth act on free sugars that have been taken as food or drinks to produce acids. Remember, this happens only if the foods or drinks remain on the teeth, giving adequate time for bacteria, and can be avoided if the mouth is rinsed or brushed after foods or drinks. These acids attack enamel and damage it. This is called demineralization of the enamel. The speed of demineralization will be faster if the intake of free sugars is frequent. If demineralization is not addressed on time, it can lead to decay and cavity formation. Let's again review the major factors involved in the etiology of caries. Free sugars. Remember, free sugar is sugar added to a food or drink. Adding honey or syrup will also be considered as adding free sugars. Sugar metabolizing bacteria present in the mouth. Remember that these bacteria are part of normal flora of mouth. Personal factors like tooth and absence or less amount of saliva. As indicated before, leaving food or drinks in the mouth for an adequate time for bacteria to form acids. You will now agree that the most crucial factor for dental caries to occur is intake of free sugars. In the presence of free sugars remaining on the teeth after sugary food and sweetened drinks for adequate time, the bacteria present in the mouth will initiate the process of demineralization. If not addressed, this will continue to form dental caries. Let's now review the stages of dental caries. Dental caries are cavities that form on the tooth surface. It starts with the demineralization of the enamel, which leads to formation of visible white spots on the tooth surface. Demineralization is the process by which organic acids destroy the mineral content of the enamel and is the first step toward cavity formation. When enamel is exposed to an acidic environment of pH 5.5 or lower, hydroxyapatite present in enamel tends to get dissolved to form calcium and pyrophosphate ions. This makes the surface of the enamel softer and porous. The good news is that in its initial stages, when the cavity is not formed, it can be reversed by a process known as remineralization. If the demineralization is not reversed, then it leads to the further destruction of enamel and a cavity is formed. And this is an irreversible process. The treatment for this stage is a timely tooth filling. If treatment is delayed, caries extends to a deeper layer and reach the dentin. It is during this stage that there is an increased sensitivity to hot and cold food and drinks. This stage can also be taken care of by dental care providers and needs a tooth filling to stop its further progression. If the dentin caries is ignored and not addressed, then it reaches the innermost layer of the tooth called pulp. The pulp contains nerves and blood vessels. Hence, infection of the pulp will cause pain. This stage is known as pulpitis. At this stage, root canal treatment is required to remove the infected pulp, followed by filling, and may even require an artificial crown. If the infection reaches the tissues and bones around the root, it leads to the formation of pus and swelling. This is known as periapical abscess. This leads to moderate to severe pain and can be either treated by root canal treatment or may even need the tooth to be extracted. Having learned the different stages of dental caries, let us now understand how fluoride works on teeth to prevent caries. Fluoride, when present in adequate amounts in the mouth, can prevent caries in 3 different ways. The main mechanism of action of fluorides is by repairing demineralized enamel. Further, it also increases the resistance of enamel, preventing it from being dissolved during the acid attack. It reduces acid production by bacteria in the mouth. Let's discuss each step in a little more detail. Fluorides can repair the white spots and demineralized enamel by a process called remineralization. It is the process that reverses the effect of demineralization by restoring minerals, calcium and phosphate to the hydroxyapatite latticework structure. Thus, when fluoride is present in adequate amounts in the mouth, it repairs demineralized white lesions by forming new surfaces to cover the lesions. Another way in which fluoride prevents dental caries is by forming a layer on the enamel and increasing the enamel's resistance to dissolution during the acid attack. Fluoride can also enter the bacterial cells present in the plaque and decreases the acid production from sugar. This decrease in acid production protects teeth from occurrence of dental caries. Thus, fluoride works on 2 of the 4 factors, tooth and bacteria, to prevent dental caries. Congratulations! You have now completed Unit 2 of Module 1, Effects of Fluoride on Teeth. In the next unit, we will learn about use of different types of fluorides to prevent dental caries. Welcome to Unit 3, Different Types of Topical Fluorides Used in Dentistry. This unit will explain to you 2 different ways fluorides can be used to prevent dental caries and the types of topical fluoride applications in dentistry. Fluorides can be delivered in 2 ways, topical and systemic, to prevent dental caries. The first way is by applying it to the surface of the teeth, which is known as a topical application. Commonly, it is applied as fluoride toothpaste by own self or as a varnish by an oral health worker. The other way is by adding to drinking water or as supplements of foods, milk or salt, which is known as the systemic application. Systemic application is typically used in community settings. Whether it will be water fluoridation, salt fluoridation, or milk fluoridation is based on the national context. It should also be noted that if a child consistently ingests too much fluoride while the teeth are still forming under their gums, they may develop a condition called fluorosis. This appears as white or brown spots on teeth. The most common circumstances that this can happen is when drinking water from heavily fluoridated natural sources. This can be seen in certain geographical locations of the countries where the deep wells are still the primary source of drinking water. Thus, systemic fluoridation recommendations vary according to geographical context. When fluorides are directly applied on the surface of the teeth, they are called topically applied fluorides. This is a very effective method when the products have relatively large concentrations of fluorides. It is recommended that application be done at regular intervals. Topical application can be of two types depending on the way it is delivered: self-applied and professionally applied. Self-applied topical fluorides include those products which are used by individuals at home. Fluoride-containing toothpaste is the most commonly recommended product. Fluoride gels and fluoride mouth rinses are the other available products for self-application, but have to be used under professional guidance. The recommended concentration of fluoride in toothpaste is 1000 to 1500 parts per million. For most people, adolescents and adults, brushing at least twice a day with fluoride toothpaste is considered optimum. Timings of brushing can be the last thing before going to bed and any time during the day, usually recommended to be done in the morning. Thorough brushing may take at least 2 minutes, the main rationale being it takes this much of time to ensure that all tooth surfaces are cleaned effectively. For children, brushing should start as soon as the first primary tooth erupts using toothpaste containing at least 1000 parts per million of fluoride. For children, using only a small pea-size amount of fluoride toothpaste on your child's toothbrush is recommended. There are special precautions and recommendations for the children. Supervised brushing is usually recommended until at least 6 years of age to encourage using the correct amount of toothpaste and to discourage swallowing. As soon as they learn to spit out, which is usually around the age of 3 years, children should be encouraged to spit out excess toothpaste and not to rinse the mouth with water after brushing. From 6 years of age, many children can brush their own teeth but will still require supervision, motivation, and possibly assistance. The details of the fluoride products and the technique of application of fluoride varnish by dental and other health providers will be described in Module 2. Congratulations! You have now completed Unit 3 of Module 1. Different types of topical fluorides used in dentistry. You have now completed Module 1 on use of topical fluorides to prevent dental caries. You have learned about basics of fluorides, role of fluorides in preventing dental caries, and different types of topical fluorides used in dentistry. Welcome to Module 2 on application of fluoride varnish by dental and other health providers to prevent dental caries. By the end of this module, you will describe the products of professionally applied topical fluorides and how to perform the application of fluoride varnish to prevent caries. This module is delivered in 3 units. Welcome to Unit 1, Types of Professionally Applied Fluorides. This unit will explain to you the importance and benefits of professionally applied fluorides, indication for professionally applied fluorides, and the different types of professionally applied fluorides. In Module 1, we discussed how fluoride can make teeth stronger and prevent dental caries. We also learned about the use of fluoride-containing toothpaste as a self-applied method of topical fluoride to effectively prevent dental caries. Let us now explore other ways fluorides can be applied topically. It has been proven in studies that routine use of professionally applied fluoride provides benefits to all persons, especially to those at high risk for tooth decay. It mostly benefits those who do not consume fluoridated water, those who do not brush daily with fluoride toothpaste, or those with a rich and frequent free sugars diet. Fluoride varnish application is recommended for all children aged greater than 2 years at least twice per year. The products that are recommended for professional applications have much higher fluoride concentration but are within the safe limits. Thus, they are safe to use in patients and don't pose the danger of dental fluorosis. Other than for all children who are more than 2 years, professionally applied fluorides are also specifically indicated for specific other groups, such as children with special needs who have difficulty brushing their teeth, special patient groups like orthodontic patients, patients who are at high risk for caries, for example, after gum surgeries, patients undergoing head and neck irradiation, and patients with decreased salivary flow. The commonly used types of professionally applied fluorides are fluoride varnish, fluoride-containing prophylaxis paste, mouth rinses, gels, and foams. Depending upon the method of dispensing, the concentration of fluoride differs among products. Of these, the most commonly used product is the fluoride varnish, and you will know more about it in Unit 2 of this module. It is important to note that fluoride varnish is the only topical agent to be used in prevention of caries in preschool-aged children. Congratulations! You have now completed Unit 1 of Module 2, Types of Professionally Applied Fluorides. In the next unit, we will look at fluoride varnish, what, when, and where. Welcome to the Unit 2, Fluoride Varnish, what, when, and where. This unit will cover the basics of fluoride varnish and also the benefits of the different types of professionally applied topical fluorides. It will also cover the mechanism of action of fluoride varnish, when and where fluoride varnish is indicated, and frequency of application to prevent dental caries. Let us first understand what fluoride varnish is. Fluoride varnish is a popular and effective treatment used to prevent caries in children. It contains 5% sodium fluoride, which amounts to 22,500 parts per million, and is a concentrated form of fluoride that can be used as a paint by healthcare providers on all surfaces of teeth to prevent caries. Now let us look at the benefits which make it a popular treatment to prevent caries in children. Fluoride varnish is easy to apply. It is a safe and effective method and is not associated with any treatment-related adverse events even in young children with newly erupted teeth. Besides dental professionals, non-dental health professionals like primary care physicians can also be trained to provide this treatment. Children can immediately go home after application. Soft foods and liquids may be consumed 30 minutes after the application. In the Module 1 of this course, you learned the effect of fluorides in preventing dental caries. Recapitulating these effects, fluoride varnish adheres to tooth surfaces, forms a protective layer. This makes it most effective, and this improves fluoride uptake into surface layers of enamel and strengthens teeth. It further stabilizes and prevents the progression of early caries or white spots on the teeth. Research shows fluoride varnish application can result in a 35 to 40% decrease in caries in communities. Who would benefit from fluoride varnish, and how frequently should fluoride varnish be administered? Fluoride varnish has been shown to be effective when reapplied after a certain interval. Application of fluoride varnish after every 6 months, that is twice yearly, is considered optimum. For children at higher risk, more frequent applications are recommended, acceptable up to 4 times per year. The frequency of application should be higher in children with high risk of dental caries, children with special needs like physically challenged, and children who have difficulty brushing their teeth. Few instances where its use should be avoided are in patients with acute infections such as ulcerative gingivitis and stomatitis. Although fluoride varnish is mainly used for children, but in reality, anyone at risk of tooth decay could benefit from the preventive treatment. Congratulations! You have now completed Unit 2 of Module 2, Fluoride Varnish, What, When and Where. In the next unit, we will look at the step-by-step guide for fluoride varnish application. Welcome to Unit 3, a step-by-step guide to fluoride varnish application. This unit aligns to one of the main objectives of this course, which is to refresh the skills of the trained oral healthcare providers to perform the application of fluoride varnish in young children to prevent caries. The requirement of materials for fluoride varnish application are collectively termed as fluoride varnish kit. Following are the contents of a fluoride varnish kit. An oral health examination set. This includes stainless steel or plastic tray, dental mirror with a straight handle, dental explorer or a sickle probe, dental tweezers, and an overhead orientable light. A personal protective equipment PPE set. This includes face masks or FFP2 masks, examination protective gloves, and protective glasses. Consumables such as sodium fluoride varnish, 5% sodium fluoride of 22,500 parts per million, cotton pellet, disposable cotton rolls, and floss. Optional items such as dental micro brush, cleaning and polishing brush can be included based on the availability. A first aid kit equipped to manage a rare event of allergic reaction should also be available when performing the procedure. Now, let us see the step-by-step application of fluoride varnish to young children. The basic steps are shown here, and we will learn more details of each step. Before applying fluoride, it's important to talk to the caregiver and explain the procedure to them. It's a good idea to assure the caregivers that fluoride varnish is safe to use and plays a preventive role in dental caries. Remember to mention a rare occurrence of allergy, reassuring that it can be managed if it happens. Inform the caregiver that the child's teeth may become discolored temporarily post-application. Always provide an opportunity for the caregiver to clarify any queries they have to address some beliefs or myths around use of fluoride. The second step is to properly position the child. For young children, knee-to-knee position is used. That is, placing the child on the caregiver's lap with the head on their knees and the legs around their waist. Caregivers can help with holding the children's hands and feet if necessary. Oral health professionals can work from above the head. For older children who can follow the instructions, place the child on an exam table or dental chair. The step 3 in the process is drawing the teeth. After positioning the child, open the child's mouth using slight finger pressure. First, clean the teeth using water and then dry the teeth with gauze. Then apply a thin layer of fluoride varnish using a cotton pellet or, if available, a dental micro brush. Start from the lower teeth. First, cover all the surfaces of the teeth at the back of the mouth, also known as posterior teeth, and then apply to the teeth in the front of the mouth, also known as anterior teeth. Then cover the upper teeth, again starting from proximal surfaces, that is the surface of teeth adjacent to each other, and thereafter covering the rest of the surfaces. Preferably, cover the teeth at the back of the mouth first, followed by the teeth in the front of the mouth. Avoid applying varnish to gums. Once a varnish is applied, there is no need for drying. There is no need to worry about saliva contamination. Therefore, children can close their mouths immediately after application and can go home. Inform and instruct the caregivers about care after the application. Tell them that the teeth may appear yellow and non-shiny for 24 to 48 hours. Fluoride varnish works best when it coats the teeth for an extended period. Therefore, avoid eating hard abrasive food that has the tendency to remove the varnish coating for 24 hours, or at least for a minimum of 4 hours after the procedure. Children can consume soft foods and drinks 30 minutes after the treatment, but should avoid hot drinks, mouthwash, brushing, and flossing for at least 4 hours. The oral health professional should also take this opportunity to counsel the caregiver on general care of the teeth of the children. The children should be encouraged to clean and brush teeth with fluoride toothpaste twice a day, every day. They should be educated to avoid snacking or sipping sweet liquids throughout the day. Also, teach the children the importance of choosing healthy snacks like fruits and vegetables over sugary or sticky snacks. Caregivers should additionally be educated on how they can regularly examine children's teeth. Congratulations! You have now completed Unit 3 of Module 2, a step-by-step guide to fluoride varnish application. You have now completed Module 2, Application of Fluorides by Dental and Other Health Providers to Prevent Dental Caries. In this module, you have learned about the professionally applied topical fluorides products and how to perform the application of fluoride varnish to prevent caries.